Don't know if my microphone's working.
I can hear you now. It's working now. Dr. Brain? Dr. De Brain?
Yes, actually, yes. Can you hear me now?
I can hear you, but just move so that I can see the face properly. Yeah.
Yeah, I'm just trying to get, excuse me, I've been rushed around. I've been pulling calves out of cows and treating sick calves. So I just got the briefing of this meeting half an hour ago.
No, don't worry, man. Don't worry. It will be an easy meeting.
Yes.
You'll be educating us about your profession, and then we'll ask questions to that, and how that is impacted by COVID-19.
Yes, absolutely.
All right, so the first 10 minutes or so is just me asking you about, the role of a vet and all of that, private, public, research, whatever, and then zoom in to actually from the day of the state of disaster, what happened, what did you guys have to do, and what SAVA had to do in guiding the members of the association, which services are essential, which ones are not, and all of that.
Yes, excellent. Okay. Is the lighting all right, or should I get a bit of light from this side?
No, the lighting is all right. I think the background is maybe too white. The thing at the back.
Painting, that's fine.
Yeah, the painting it reflects light.
Yeah.
So we still have about 12 minutes to go, but it's always better.
Excellent.
Yeah, now you're much better now without the background. Yeah.
Super, thank you. Great.
All right, so you can go and meditate. I won't touch anything on my side. You don't touch anything at 5-2, and then at 5-2 must just be seated.
5-2. Excellent, Fundi, thank you.
All right then. BVSC from the underserved institution in 1995. He currently practices at the Port Alfred Veterinary Clinic. He got his education today, but it's actually practice. And it's also involved in wildlife. We've got 6 minutes.
Excellent. Good. Okay. The prayer is accomplished.
Now,
For the
when you start with prayer, then everything is just gonna go well.
Yeah. No, we need the Lord to lead us in this challenging time, eh?
Definitely. You know, we definitely, because I mean, he has the power to stop any pandemic. So
Yes.
he allowed it for a reason, and ours is to seek guidance from him to say,
No, absolutely.
what's the lesson that we need to learn as humanity, you know, out of this whole situation?
Yeah, you know, there are a few people that said, "Oh, it's a punishment sent by God," and God doesn't create it; it happens in the world. But He's allowed it, and as you say, it provides an opportunity for us to re-examine our lives.
Exactly.
And see, well, where's an opportunity to improve
and change?
Yeah, make necessary changes. And I think the lockdown, much as it's become frustrating for many people, it's always also provided an opportunity for introspection and just examining our faith and how we live our lives.
Yes, but now, in line with today's topic, though, I think also our relationship with animals.
Yes, absolutely. Yeah.
We need to look at, you know, how we relate with animals, because look, in China, they eat anything that walks or that crawls. You know, and we've been, you know, the whole world has been battling with you know, the what do you call it now, the black market trade of pangolin.
Yes, the black market for illicit trade.
Yes, exactly.
And it's not, I mean, and as you say, I mean, we look at our rhino and our pangolin, but then there's the lion bones, tiger bones.
Exactly.
But it's interesting that if it has come out of a market where you've got unnatural food animals placed next to each other, that might well have started that. That's an interesting thing. And I mean, they take bears and they put them under anesthetic, and they put under ultrasound, they put a needle in their gallbladder to get the bile out, because they think that's good medicine as well. Terrible.
So now we've got 3 minutes to go.
Okay.
All right, let's just focus. Good afternoon, ladies and gentlemen who have joined us via a number of social media platforms. My name is Dr. Fundi Lenyati. Today, we have an interesting topic. For the last 13, 14 days of the lockdown, we have been dealing with topics that are more dealing with, the pandemic, its impact on human beings, the economy, the law, and things like that. But we have missed addressing another very important, area, and that is the area of domestic animals. Because in most households, there are domestic animals, dogs, cats, and many other types of pets. And, there hasn't been much focus out there also, to address some of the concerns or misconceptions or myths around, animals and the COVID-19, pandemic. So we thought today, working with the South African Veterinary Association, we thought that it is important to have that kind of discussion as a way of creating awareness about the role of the Veterinarian Association, the role of veterinarian surgeons, and how that role has been impacted by the state of disaster and the lockdown. So today we have our special guest, Dr. Leon Dubrain. He is the president of the South African Veterinary Association. He qualified with a BVSC from underserved quite a number of years ago. That's in 1995, but he practices as a vet in Port Alfred at the vet clinic in Port Alfred. And this is somebody who comes from a family where he was exposed to animals, pets, at home, animals in the family farm, and animals in the game reserves and national parks. So he's got love for animals, not only for domestic animals, but also for wild, wildlife animals. Now, he is the president of the South African Veterinary Association. He is very involved on professional matters, growing through the structures, in the Eastern Cape. And now he is at the helm of a national body. And also he participates in a number of other associations. So welcome to Dr. Fundi platform, Dr. Dubrain. Let me just call you Leon.
Yeah, thank you, Dr. Nyati. If you don't mind, I'll call you Fundile. And welcome, thank you for the invite and welcome to the viewers and listeners. I'm grateful that we have this opportunity to engage today and just put our side of what it's been like under the COVID-19 outbreak and lockdown. And just, I think there's a lot of, as you say, miscommunication. I don't want to sound like a certain president, but there's a lot of fake news out there.
Yes.
But it's important. People are beginning to panic. Their misconceptions, and we would like, for the sake of our animals and the population and the country, to inform them as much as possible so that we can put everyone at ease as much as possible, but also take the necessary precautions to avoid humans or animals becoming sick.
Definitely. Now, just to kickstart the discussion, I just want you, we've got an hour here to talk, so we're not in a rush. I always want us to have a solid foundation before we get to specifics. So I just want you, for the benefit of the people who are watching, just to make us understand what is the role of a veterinary surgeon.
Okay, yes, all right. So it's a complex role because we deal with animals, and there are many different types of animals. So many people see the veterinarian as their companion animal veterinarian who's looking after their dog, cat, hamster, budgie, chameleon, bearded dragon, what be it, parrot. And they are a large proportion of veterinarians, and they play an important role in terms of the health of the animals, but also the health of people. People's pets are very dear to them, and in terms of mental health, emotional health, often occupational health, it's important that people have a good engagement with their pets, and they're also utilized in facilities for people with disabilities. There are healing horses, there are guide dogs, there are dogs that help people that have other mental problems that help them.
Even the police, they use the
police use them, and they're used in many ways like that. We have the police horses, we have the horses in the army. There are the dogs that are involved with anti-poaching, in Kruger and other reserves to help track poachers of rhino and other animals. And then we have many veterinarians that are also involved in food production. If you think of all the cattle, chicken, pigs, sheep, goats, etc., veterinarians are involved in many steps to ensure the health of those animals and the food safety, the quality of that food, and the quality of life of the animals too, which is a priority, because we're in the veterinary profession. We want to work with animals, but we also love animals, and we have their best interests as well as the interests of the public at heart. And then there are vets involved with horse industry, whether it be horse racing, whether it be leisure horses, show jumping, showing. The horses involved there, and the horses involved in wildlife. And I'm quite fortunate, as you said, I have a background where I've been on farms, I've had pets, I've been in game reserves, and just this week I've been treating dogs, cats, buffalo, horses, cattle, sheep in the last 3 and a bit days. So I'm
and
fortunate
you
that
called for this interview. Actually, you were busy treating the animals when you were told, "Hey, please rush and go and be ready for the interview."
Yeah. So the animals don't know that there's a lockdown, except for maybe the dogs, because the dogs are upset because they can't go for walks. So the dogs know there's a lockdown, and the dogs are upset with the cats because the cats are still running around. But the animals are still becoming sick. So we are busy, and we're trying our best to see that we can look after the animals and the food safety and security of the country, to optimize the production, because that's crucially important. And as we say, people now, we've got the threat of a virus, and people's immune system is crucial. So we need quality food and vitamins and nutrients to be taken by the people.
Yes. All right. So basically, it's a wide range of services that a vet, provides. Domestic animals, wild animals, animals used in different, industries or other careers. So okay. So now, on the 15th of March, our president declared a state of disaster.
Yes.
Now, what did that do? That state of disaster was followed by some regulations, a few days later. So can you just take us through then that what happened, when you guys, were sitting and saying, oh, there's this state of disaster, there's gonna be a lockdown. What did you do as the Voluntary Association of Veterinary?
So the Veterinary Association, we suspected it was coming, and Gert and I, MD, were supposed to be heading off to New Zealand on the 1st of April to the World Veterinary Association conference, and we had our meetings, our board meeting and our Federal Council meeting on the 13th and 14th. So we knew something was brewing, but as we were sitting at those meetings, the New Zealand lockdown began, other lockdowns began, and we knew something big was coming. With the president's address, then it put quite a few things in perspective, and it's great that he and the government took those steps. But at that time, of course, the priority was the human health. Everyone thought of the essential services in terms of the human health, and then we had to work with the government department. We are overseen by the Department of Agriculture, Land Reform and Rural Development, as it's now known. So we engaged with their chief veterinarian, Dr. Mike Modasani, as to how these regulations are going to work with veterinarians, and veterinary services were declared essential services. But then
I was going to ask you that. I was going to ask you that because just like you've got medical doctors looking after human beings, you guys look after the animals. You are the doctors for the animals. And so it definitely has to be an essential service.
So we could give input to the department, and the Minister, Honorable Toko Didiza, was able to say, yes, veterinary services are essential services, but then we had to determine which of those veterinary services are actually essential, because there are certain services that are not essential, and there are many services that are. And obviously the government was focusing on getting the regulations for the people's safety as the priority, and then we were able, with the Veterinary Council, the South African Veterinary Council is our regulatory organization, and then we are the Veterinary Association of the members of the profession, and we were able to then give input into what services are essential and what aren't. It's obvious if your doggy just needs its nails trimmed, that's probably not an essential service right now. Whereas if it's deadly sick of biliary or some other infectious disease, or gets run over by a car, that is an essential service and it needs to be treated promptly.
Yeah, let's just before we go in there, because I wanted us to move nicely. So as the association, there was this State of Disaster Act. There were the regulations. So you started consulting with various stakeholders, including government, but also your own members, because you are a body that represents the interests of your members, you know, and the profession at large. Now, just tell me, before we go in, being a voluntary organization, does that mean some of the vets are not part of the?
Yes, they are, and we are working on it to improve the proportion of veterinarians that are members. But it's a work in progress. So it's a voluntary organization, but over 60% of the veterinarians in the country are members. So we represent, you know, by far the majority. And through our input here, we have assisted the Veterinary Council with these guidelines, and then they have passed that on to the other members. And we haven't, you know, this is a national and a worldwide emergency. So we're not going to be, and we never are, Betty, that will say, oh, this is only for our members. We have the interests of the profession, the animals, and the country at heart. So we have asked the various groups and the council to pass on the information that we've been disseminating to all our colleagues, not just the members, so that everyone can be as informed as possible. And because there's been a lot of misconceptions out there, and I know we'll go into detail, but what has been decided at national government and what we have put forward and has been approved has not necessarily been taken at provincial or local level. So we've had a few problems there, but we've set the structures in place to deal with them. If I may, because we have the association, but we have many groups. So we will have the cattle group, the small animal group, the poultry group, the wildlife, the horse, pig, etc. And then we also have branches in the various provinces. So we then, as you said, approached our members and said, okay, those of you in this particular field, please give us input as to what in your field you consider essential services. And then we could take that to heart, and as the board of directors work on it and see, okay, what guidelines are we going to put out to the profession.
So you guys crafted the guidelines, and they were within the regulations. You know, I'm saying they were aligned to the
we
regulation.
Aligned them with. Yeah, that's why we consulted with government and with council to be happy that all our regulations our guidelines were in line with the regulations, and the feeling from government is, you know, we are professionals, we have a good working relationship with the council and with the department, and we would say, you know, if it can be put on hold, delay it. If it can't, if there's a animal health, welfare, or a food security risk, continue. But if it was necessary because of such a wide field for us to draw up those guidelines in line with the regulations, but be able to circulate them so that our members and all the profession can have a ground base to work from.
And was it an easy, acceptance when you had to provide those guidelines to your members? Was it, easy for them to know that now the scope has been limited a little bit?
No, it's not easy. Look, generally, there's been a huge positive support that thank you for giving us these guidelines and for the information that we are passing on. There's so much information, and we'll discuss it later, about the animals and COVID-19. And we've been passing it on to our members of the profession with the disclaimer that much of this has not been peer-reviewed research. It hasn't, but we'd rather that they get that info from us with those provisions and the conclusions that you can't put it as the gospel truth yet, if you'll pardon the pun, rather than them just picking something off social media and we don't know where it's coming from. So we're in contact, as we said, with the government. They are in contact with the OIE, which is the Worldwide Disease Regulatory Network. So it's all happening so fast that we can't say what's true or what's not yet, but we're putting the info out there and we're informing our members, and we want to inform the public as well so that they know. The veterinarians have been well informed. If they've got questions, please go to your veterinarian about it. Don't rely on Dr. Google or Wikipedia or some other layperson's Facebook page. Rather go to your veterinarian. We have been informing them. But to get back to your question, sorry, Fundile, on the whole, very well received. But there are certain cases people say, well, I want, this has such economic ramifications. They're a bit concerned, but that's where there is a certain amount of personal discretion or professional discretion as the veterinarian. But the guidelines are quite clear as you should be doing this, you should not be doing this. And most professions and most practices have gone, along with the government guidelines of operating with skeleton staff and for reduced hours and with the PPE equipment and the social distancing. And we are, the practices are informing their clients in terms of the social distancing and the guidelines.
Yes, actually, because I'm happy about the guidelines. I'm happy that your members largely accepted them, and they're abiding by them. Very, very, very happy. Now, coming back to the actual, state of disaster and the the main aim is to reduce infections, the number of new infections, so that we don't have a big burden here. Now, we're talking social distancing as one of the key things. So, in your world, as the vets, obviously, and we're still going to get to this one, there are essential services that people need you for. So they have to, do they just have to rock in at your practice, or they have to phone first? Because you are also at risk when they come to your practice. So has there anything changed in that space?
Yes, certainly. In terms of the guidelines that we've put out, it's no longer just a walk-in, rock up at your veterinarian. You must phone first for an appointment, and then if the receptionist can't determine it, it's put through to the veterinarian as to whether it's an essential or necessary procedure. And we are allowing a bit more discretion, and the council is too, in terms of telemedicine, or that if you're fairly sure that you can accurately diagnose and treat a condition over the phone, and the person comes to collect the medicine in a socially responsible manner, then we are allowing that. If the animal needs to be seen, then the client can bring them in. Most practices have set up screens. They can't just all pile into, and it was difficult at the beginning. People are used to just coming in and sitting next to each other, and I saw it in doctors' rooms. I saw it in our reception. You got to get used. People, we're a social species. You know, we're used to being close to each other. To be told no, you're only allowed 2 or 3 people in in the waiting area at one time, and we are asking people to wait in their cars to be called. And also, we often have the situation where the whole family wants to come with the dog. You know, you have the mother and the 3 kids, and I had to say, you know, well, one of you choose, because we only want one client with one patient in one consulting room with the vet. So, excuse me, they need to get, it's taken a bit of getting used to, but people are getting the hang of it. So yes, phone for an appointment, wait in the car once you've informed the receptionist, and then hand sanitizing, social distancing, you know, a meter and a half within the waiting area, and then sanitizing on the way out. And the same for collecting food. You know, the feeding of animals is also an essential service. So people need the dog food. Many dogs are on prescription diets or special diets. They can't just go and buy supermarket food. So, but then we arrange the people phone in advance, the invoice is prepared, the food is booked, the invoice is emailed, they do an EFT so that with the proof of payment, so we avoid the cash or credit card contact, that kind of thing. So look, there's certain people, some of the pensioners don't do EFTs, and we make a plan. But on the whole, it's working quite well. But we had that problem a bit. The Western Cape government was shutting down the vet shops in the mall, so we actually had to get Dr. Modusani and we, our MD Gert, and the board, we put together a document explaining that that animal foods are an essential service, and must remain open for the food and the parasite control, tick, flea, worm treatment. We can't just stop deworming or treating because we'll have a disease outbreak. But obviously people can't go and buy dog beds and collars and leads at this stage. They're not supposed to be walking their dogs anyway. And the Senate and it's that interaction has helped, because the Western Cape government then said, oh yes, okay, we understand, we allow the vet shops to continue.
Okay. So you've just mentioned that food sales is an essential service. I'm just looking at some of the things you listed in your document. Medication refills, definitely, it's an essential service. Vaccinations for rabies or other vaccines is an essential service that needs to be given. Flea, tick, something. What's this?
Treatment, ectoparasitides and endoparasitides, the dewormers. But there's also, just in terms, so I can inform the public, certain vaccinations are essential and certain not. You know, if you have a pet that's been vaccinated for 3 years in a row, then it doesn't need a booster vaccine now. It can wait till after the lockdown. Whereas if you've got a young puppy who hasn't had a vaccine or has only had its first or second, and puppies need 3 vaccines in the first 3 months of their lives. If we don't do that, we could have major parvovirus or cat flu outbreaks. And for kittens, they need their vaccines as well, so they don't get snuffles or cat flu. So certain vaccines are essential, certain are not. And that's where it's better, again, for the client to phone the vet and say, look, my animal's due for its vaccine. Is it an essential service? And the vet can then advise them as to what it is.
Okay. All right. And obviously, if something is life-threatening to the animal, that's an essential service.
Absolutely. If the animal is sick or it's injured, and even if it's, if the animal, if it has a bad skin infection or a bad ear infection, that is a necessary service, because the animal is in discomfort. It's not elective. But as you say, if it's got some little lump on it that's been there for 6 months, you can't now go and say, oh, I'm going to take it to the vet now for surgery, because it's not essential. It can wait.
It's not life-threatening to the animal.
No, exactly.
Yes, but those that have got chronic illnesses, though, that have to go for a review. to see if things are going well or not?
Yeah, well, there again, there'll be a distinction. Depends on the condition. If the dog has arthritis and it's on medication, at this stage, we will on the telephone say, well, how's it going? Is the dog doing well? And then at this stage, we'll give them a repeat prescription, and then it can have a follow-up check once the lockdown's over. However, if the dog has developed a problem or it desperately needs a kidney and liver blood test to check that the anti-inflammatories aren't causing harm, if it appears to be sick, then it requires the treatment, but again, with the necessary precautions, as little contact between the client and the clinic staff and veterinarian as possible. And again, there's risk. We must determine, is the client a high-risk client or a low-risk client, because that determines the level of service. It's the risk-benefit. So a patient from a very low-risk household, you may do a procedure that's not quite life-threatening but needs to be done. Whereas if it's from a positive household, then you've got to be more careful, and it would really be need to be a life-threatening condition for that animal to be brought in.
Yeah. Now, things like sterilization, would you consider that as essential, that has to be done now, or is it something that can be postponed to be done after lockdown?
Yeah, that's been a slightly debatable. I see the smile on your face there, Fundile. The feeling from the government was that sterilizations are not essential, and on the most case, that is true. So if it can be delayed by a month or two, then and there's a fair risk, then definitely it should be delayed. But we also don't want a situation of, if an animal is about to come into season and there's another dog and there's going to be unwanted pregnancies, or cats especially, if cats aren't sterilized, female cats, they become pregnant very, very quickly. They get out. So
why are we blaming the females there?
No, don't worry. I'm also saying if a male cat is not neutered, it is more likely to go roaming and get into fights and possibly contract diseases. So one's got to again use one's professional discretion as to it's not an essential service, but it might be a necessary service.
Yes.
But in certain cases, it's necessary to perform those sterilizations. But once again, it must be from a low-risk household.
Yes.
And if it's a high-risk household, then someone else there must be and we've got to be careful. This virus is quite resistant, so we've got to be careful.
Yes.
The cat box might have, coronavirus on it. We've got to be careful with those. So preferably no sterilization from a high-risk household. A low-risk household, if the sterilization is necessary because there's going to be a problem, if there isn't a sterilization and the necessary personal protection equipment and precautions, social distancing precautions are taken, yes, we can do certain of those sterilizations.
Okay, so this concept of social distancing is obviously human to human, because COVID-19, it's a human to human, type of infection. Although it was originally an animal, infection that crossed over to humans. Now, what I want to find out, there is no need for social distancing between your pet and yourself.
No, not if you're negative. If you're negative, there's no need.
Yes.
If you are positive, the problem is there's so much, and we're going to go into detail, I'm sure, about it. But first, there was the dog that was positive in Hong Kong.
Yes.
That tested positive. But it was weakly positive, and we found that, obviously, if a positive person coughs on their dog, then there will be virus on the dog, and it might lick itself, and then there will be virus in the mouth and in the throat, and that could then test positive. As far as dogs go, we've got no sign that the virus is replicating within the dog.
Yes.
Cats, on the other hand, I'm sure you've heard about the tiger in the New York Zoo, that the tigers that have tested positive and their zookeeper was positive.
Yes.
And we've seen that the virus, you know, can locate in cats. It's not very clear on the replication. You know, this is all very new because no one's had to deal with it.
This is a new virus. It's only 3 months
every
old.
Day, and we've been focusing on the people. Now suddenly, oops, we must focus on the animals as well. And there is research out there, but please, people, be careful. All of this research, it hasn't been peer reviewed yet. That's why when we get the results of the research, we send it out, but we're saying this, you cannot take this research as factual yet. You know, it needs to be reviewed. We need the OIE. So the cats, there's a little bit of a concern, but there is no concern that the cats can get it from the people. But there's no proof that any animal, any companion animal, and no chickens, ducks can transmit that COVID virus to humans. So please, we've had early on in the outbreak, someone phoned one of my board members, he was a former client and moved. He said, no, he wanted to drown his dog because after the Hong Kong story, he was worried his dog would make him sick, which is rubbish. But people panic, you know, they read it. And the risk is more that animals should be saying, you know, stay away from me, you could make me sick. And that's not, the dogs is not the case. There's a possibility in the cat. There's some research in ferrets that they've made the virus, they've tested it on ferrets, which are often lab animals overseas, and the virus has replicated in ferrets and has possibly spread it to other ferrets, but there's no even of them spreading it to humans. But, you know, ferrets are not a major problem now, or not a very popular companion animal in our country, so we're not worried. But please, there's no proof whatsoever that you can catch coronavirus or the COVID-19 coronavirus from your dog or your cat. There's no proof of that. Also, we must please not panic about this. But in the positive household, if you have positive household, the same as you mustn't cough on your daughter if you're positive. Also, just don't cough on your dog or your cat. And and just, you know, and please don't spray your cat with sanitizer.
So what must happen then?
If the cat, you suspect the cat is contaminated, you can use a baby shampoo. Any shampoo, soap that foams, it breaks up the lipid capsule of the RNA virus of that Corona 2 virus, and that will kill the virus. So please don't spray alcohol or sanitizer on your cat or your dog. It's only likely to make it sick and being tested as safe on animals. Just if you want to wash it in a safe, you can even use a human shampoo, but you know, just please don't hurt your animals when you think you're trying to help them, you know.
So now, what other myths, when it comes to humans, there's been a lot of myths around COVID-19, a lot of misinformation. Now I'm interested in your area, as the vets, animal health. What kind of myths or misinformation has been circulating in social media, stuff that you guys had to actually address?
Well, you might have to address. I have been following the official things and what goes. As I said, we've had to deal with from their dog. They might now catch it from their cat. The professor phoned me the other day once this whole animal thing coming out, and they're saying that people are panicking because their tiger farms and animal farms near Rayton, and now the people are wanting to, what are we going to do about these tigers? We must get rid of these tigers. And then, there's people are now, they're wanting to, there's a risk, people might want to start killing stray cats because what happened was there was in Wuhan city, some Chinese researchers did some research testing antibodies and they tested the antibodies from the positive families, and they had the highest antibodies, and then there's some stray cats had some antibodies. Well, but they're very low, so it's probably just a reaction of contamination in the environment. And again, it is not research that has been proven yet. It's one trial, it's one study, it isn't peer reviewed. So there are all sorts of things, you know, I might catch it from my cat, I might catch it from my dog. No truth in that at all.
There's no animal to human,
rather,
you know,
if you're in a positive household. Now, but what is also...
Yeah, you can continue. You can continue.
Sorry, the internet's just a bit up and down. We don't have fiber here in Port Alfred yet. But what is responsible is if you are in a positive family, apart from the social distancing and hygiene with your animals, is at this stage it's sensible to keep your cat isolated. If you're in a positive family, don't let your cat run to the next door granny's house or whatever. It's just, you know, we're still learning. We have no proof of anything yet, but a positive family should be isolated, pets and humans, just logical, quite honestly.
Yes. So now, okay, so we are in day 14 or so. I'm not sure, I've lost count actually. What day is it now in terms of the lockdown? I'm not sure whether it's day 13 or day 14.
We're on the 9th, eh? We're on the 9th, yes.
Yeah, but anyway, with
I think we're day 14 here, day 14 now.
Yeah, so with the human beings now forced to stay in their houses or in their homes, that obviously means if there were, you know, dogs there that needed to be walked, there won't be as much physical activity than there was before the lockdown. Now, what kind of issues is this bringing? The fact that they are eating, but they're not exercising.
Yeah, and I think there's mental health issues for the owners and for the dogs, because I mean, I know clients, I see them walking their dogs in terrible weather, and they said, but the dogs drive them, this is before the lockdown, the dogs drive them mad if they don't go for their walk at 5 o'clock. So we have to adjust to finding new ways to keep the dogs occupied, you know, running them up and down the driveway, throwing balls for them. But yes, it's important for the food, you know, to reduce the food possibly by 10%, because the exercise levels are decreasing.
Now, obviously, again,
the dogs are becoming frustrated.
Can you repeat that?
And also the animals can become frustrated. I mean, I had last night a call because two dogs, you know, they've been together for a year, they're both neutered males, and now they suddenly just fought with each other, you know, and you don't know, well, is it the frustration of being cooped up as well? You know, what's going on there?
Yeah. Okay. So so basically the same considerations that we have for humans, you know, the fact that people are stressed, they're anxious, they you know, being cooped up in their homes is not natural. So even animals, they have that. So and you might have mentioned this. So how do you see that an animal is actually stressed? Leon? Hi, Leon?
Sorry, Fundi, our bandwidth. Our bandwidth just went a bit low there. What you were saying about the humans being cooped up?
Yeah, I'm saying animals also, they get stressed. Now, I just wanted like basic stuff, you know, especially the common domestic animals. How do we know that my cat is stressed, or my dog is stressed, or my parrot is stressed?
So, you know, dogs, they might show behavior change. They might start, you know, excessive licking, grooming. Cats especially will start licking themselves and they might, start plucking their hair out, and parrots do that. If the parrots stress, I mean, not that the parrot should be worrying too much about lockdown, because it should always be generally locked down. But it might start plucking feathers and doing abnormal things like that. Yes.
Okay. All right. So, what challenges are your members experiencing that are related to the COVID, though, to this lockdown period? Are there any unique issues that your members on the ground are actually experiencing beyond just, the type of conditions that they are treating them for?
Oh yes, definitely. Because I mean, many of us travel. Well, there are two issues. The one is that many of it seems in the last few days that the security forces are becoming a bit more strict.
Yeah.
And they are wanting more proof from the people that they're actually going to an essential service. I mean, I hear that because people are getting bored, they're driving up and down and not actually buying things from the shops. But so yesterday they actually stopped a client with a horse in severe colic that was traveling to a hospital for colic treatment. And I mean, equine colic's a huge emergency, but they wanted proof that this was an essential service. And it turns out it was resolved. My vice president is a colonel in the Defence Force, and he, has contact with the command structures. So they managed to resolve that, but they actually were just looking for a letter from the veterinarian proving that the animal needs to go in. And I mean, we've been doing that. We have clients that visit us from Grahamstown. But we can also, if you have a WhatsApp, with your name on, that could serve as proof that the owner is bringing the dog in to the vet.
The doctor.
But they've also been in the early days in the Western Cape and the Northern Cape, they stopped some veterinarians that were going to do scanning of sheep, which on the face of it is not an essential service. But the problem is, if you don't scan those sheep, you don't know which one's pregnant, which one has one lamb inside, which one has twins, which one has triplets, and they all need different levels of feed so that they can lamb properly and the lambs can be healthy. If they feed all of those the same, the one with one lamb, the lamb will get big and inside it will get stuck. Whereas if you don't feed the ones with triplets enough, they will be weak. So we had to get that cleared up with the regional structures from natural. So yes, there are challenges in terms of veterinarians on the road doing work, and also many of our veterinarians travel between provinces. So if you in a particular area, you may be serving Gauteng, Northwest, and Limpopo for wildlife work or large stock work. So we've had to deal with a few of those, but we've managed to handle it. We, within the board, we set up a helpline, and we allocated various challenges that the profession, colleagues, not just members, might have, and they could phone the helpline, and in terms of what their problem was, they'd be directed to one of us who is a specialist in that field, and we could help them with those challenges that they were having.
Okay. Now, I think we've covered quite a lot. I just want to now ask a few questions. Some of them may be sounding stupid, but I think for the benefit of some of us who are not well versed with some of these things. Now, for human beings, you've got a medical scheme, all right, that enables you to be able to consult. And the payment is done. Are there medical schemes for animals?
Yes, there are a few now. There are quite a few medical schemes now. Yes, there are. So there are, and then they're generally quite reasonable. So it's nothing, you can consult your veterinarian, please, about the various schemes. I'm not going to mention names now.
Yeah, but please.
there are a few of them. There are pet medical aid schemes, and they generally, work quite well. One thing I don't want to interrupt you too much, but Fundi, there has been a development, because I think now at day 14 we're well into the cabin fever stage, and people are looking for reasons to go out. And there have been cases of people taking or wanting to take their animal to the veterinarian where it's not really sick, but they just want to get out. And I mean, we understand their frustration, but it's not in the spirit or the letter of the social distancing to take your animal to a veterinarian. I mean, I actually saw
when the animal is not sick.
Not sick. Scott the same note, the comedian's been posting a daily thing, and he said to his fiance, must we take the puppy to the vet? Not sure, he doesn't look quite the same today, his stool isn't quite the same, must we take him to the vet? It's actually happening. And I just would like the public to understand that their frustrations, but please, if the animal isn't sick, please don't take it to the veterinarian. But if the veterinarians, we are on skeleton staff and short hours, but there's always an after hours number. If they are concerned, phone the veterinarian. We can then give them advice as to whether it is something to be concerned about, whether that needs to be seen, or whether we can dispense something. And if people, please, we also open the public, if they can't get, if they don't want to phone the veterinarians, or if they want something, specific that the veterinarian can't help them with, please phone the Veterinary Association. They'll be directed to someone who can advise them.
Maybe can you mention the number of your hotline number or something, for the benefit of people who are listening?
Yeah, well, the number is the Veterinary Association number is 012-346-1150. I will have to, if we'll just get that hotline number.
Okay. We can mention that towards the end. We can mention that we still have just about 13 minutes, so you can get that number. We will mention it before we end our crossing.
Yeah.
All right. Now, another question, again, it's easy when we talk about human beings, we can give injections, we can give tablets and all of that. Now, when it comes to animals, if it's not an injection, what other modalities? Do you give them tablets as well?
Yes, we do. We give them tablets. In recent years, there's been quite a development in chewable tablets, because obviously, you might not want to try and give certain dogs a big Rottweiler or a Boerboel tablet if he's not so keen on it. So particularly in dewormers and anti-inflammatories, there's been a development in tasty tablets, and in the tick and flea control products, there are new tasty tablets. And you can also try and smuggle the tablets in a soft food substance that they'll get. There are many jokes about trying to give a cat a pill. Cats are not easy to give pills to, so there are many jokes about that. They will sometimes take the tasty pill, but we often have liquid suspensions that we can give to cats, which are easier to give. So yes, there are suspensions, there are tablets, and often tasty chewable tablets that we can administer. Because I mean, animals like humans don't enjoy getting injections often. We do sometimes start the treatment with an injection to make sure that it gets off to a good start, and we use a smaller needle and do it as gently as possible. But yes, we do have modalities of liquids and tablets and capsules, and also capsules that you can open into the food.
Okay. And any suppositories, the stuff that is put at the back?
Yes. No, you sneak it in there. So that, just to confirm, that hotline number is 012-346-1150. That does get you through the hotline, but that is for veterinarians that are having a problem.
Otherwise, people must consult their own local vet.
Consult their veterinarian, and then the veterinarian can contact. If the veterinarian isn't sure, he can contact the hotline, and we can advise him.
Now, I'm very active on social media, and I read this and that, people posting. And one of the areas that I'm a bit concerned about, people are complaining that their budgets for food, just for the human beings, has shot up because, they are sitting at home. And other people now are considering downgrading, the food that they used to, feed to their animals and stuff. So are you seeing any challenges there or neglect of the animals because, the budget is not balancing?
Yeah, and unfortunately, Fundile, I mean, we've been seeing with this recession or the economic challenges the last few years, many people are either downgrading the food or many surrender their animals to welfare organizations, and it's very sad. And that will indeed be heightened with the lockdown and the economic constraints. So the one thing is, please, if people have had their animals on a premium veterinary food and they feel they can't afford it anymore, please speak to your veterinarian for advice as to what's an alternative, because it's horses for courses, if you'll pardon the pun. Certain dogs may adapt easily to another food, and there are super premium veterinary foods, premium and baseline veterinary foods. So the veterinarian will be able to say, in terms of, they know that client, they know the pet, that this might be a suitable alternative. Please don't just take your animal off a super premium food, particularly if it's on it for a specific reason or condition, and just put it on a budget supermarket food, because many people don't understand the veterinary food. It's not just that it's a fancy label. Those premium foods are very high quality protein, minimum amount of grain and starch, because dogs are predominantly carnivores and cats are obligate carnivores. They really should only eat meat. So the moment it's what you put in. If you're buying a very cheap bag of dog food, it's mainly going to be cereal, pet food or cereal. And many dogs may be fine on that, with that plus the bit of protein in there, but many dogs not. So once again, the best solution is, please consult your veterinarian in terms of, he knows you, he knows your pet, for advice. And the surrendering thing and abandoning it, there's the economic thing. And as I said before, now people have been panicking because of fake news or the risk of contracting from their animals. And please, people just mustn't just abandon their animals. There are rescues that can assist them, welfare organizations, ask for advice as to how to reduce the costs. But then again, one must remember that having a pet is a responsibility. And again, one must be careful to dish out puppies and kittens as presents if one's under financial constraints, because it is a responsibility, and it's very depressing to see these unwanted animals surrendered and often having to be euthanized.
Yes. Now, obviously, we are in a country that has got a lot of socio-economic, differences or inequalities. Now, the townships, largely, you find that the accessibility, or access to vet services is a bit of a challenge. And so I just wanted you to just share with me a little bit, from an association point of view, to say, recognizing that there are those underserved areas, that have got animals. Sometimes you're driving through, you see that this animal is really being abused or is not being, taken care properly. So is there anything from a association point of view, maybe some outreach?
Yes. We have the SAVA CVC, which is our South African Veterinary Association community veterinary clinics. And they specifically function in that. We've really done well with rejuvenating them in the last few years. And those specifically are aimed at the formerly disadvantaged or underprivileged communities, both in the townships and in rural areas. We're working on that. So, and those are under the control of a veterinarian and are able to supply and are supported by other veterinarians that will do the work for them at a discounted rate to enable people that don't have the financial means to receive the benefits for their animals. But it's a policy. It's not something where they get given something totally for free, but it's at a dramatically reduced welfare rate. So SAVA has the CVC, and then there are other animal welfare organizations. And then in terms of the state, there's also the compulsory community service vets that the year after they graduate, they now work for the Department of Agriculture, and they are posted in various areas so that they can look after the animals, assist the people in the rural, indigent areas and townships with that kind of work.
Yeah. Now, this is my last question to you. You know, I would like to know, what is the ideal ratio of vets to, in a population? I just want to see if we actually, have a good ratio as a country, or actually we are so underserved. And if we are underserved, what programs are there to try and increase the number of, of professionals, marketing of the profession, so that people see it as a viable profession. You might not have grown up in an environment that understands the role of a vet, but as a career option, so I'm more asking, firstly, how are we as a country compared to other countries of a similar level, developing countries? And number two, is there a plan, by the institutions that train vets to try and produce more? And maybe not necessarily, in medicine, they will also talk about mid-level, workers, somebody who's not necessarily a medical doctor, but somebody who's got some training to work independently, but to work under the guidance of a qualified professional.
Okay. Firstly, I don't know the exact statistics, but I know that our vets to population ratio is very low compared to, let's call them, many developed countries. And it's economics. It's just, Fundile, that's what it is if you've got 6 million taxpayers and 16 million on government grants and children, it's just, and the problem is training for veterinary science is expensive. It's expensive to run a veterinary practice, and that's why it's not, we're not driving around in Porsches and Range Rovers out there. There's this perception, and I mean, from the beginning, first day when we arrived, they showed us accountants make 3 times what a vet does, doctors twice, veterinarian, half of that. So we're in it because we want to work with animals. Yes, we are there. We have to make a living, but it's the economics that are creating the problem. And in our country as now, well, because of the economic pressures, same as many other people are immigrating, veterinarians are immigrating because of the economic challenges. But we are acutely aware of the need for veterinarians, and that is partially why the state has put into place the compulsory community service veterinarians. The challenges in terms of also economics, the state's budget, there are unfilled state veterinary positions, and you're talking about next level within the state, the animal health technicians who are trained to do certain primary animal health care. And there are also veterinary nurses who are trained to do a level of healthcare. But it's important that they don't then start trying to be veterinarians because they're not trained to be veterinarians. So at this stage, they're supposed to work and have to work under veterinary supervision. And they're veterinary physiotherapists. So there are different levels. So the ideal situation is to have enough veterinarians, and where possible, then employ veterinary nurses and animal health technicians to do some of the basic procedures. The problems, as I said, in terms of the economic situation, and many animal health technicians are supposed to be employed by the state, but they aren't. So that's become a challenge. There is a drive to increase the numbers of the students, but we also, the same economics are leading. There's only one veterinary faculty. From the Onderstepoort. So in the apartheid days, you had Onderstepoort, and in Garankuwa, not so far away, Bedunsa, there was a veterinary faculty at the Medical University of South Africa. Then we amalgamated. So the student numbers were increased, but there are challenges in terms of the faculty can only handle. So it's gone up from 75 to 100 to 180 students. That faculty cannot really handle more than 180 students per year at this stage. And so there was a drive to have a second veterinary faculty. And here in the Eastern Cape, the University of Fort Hare, obviously it's a renowned university where Madiba and many others attended. And it has an agricultural section, it has a farm. So there's a drive for that. But unfortunately, in terms of being an academic training institution, there's a lot that needs to be done.
For it to be accredited to have that kind of program.
The Department of Higher Education, the Veterinary Council, they must all be happy that, that those standards will be fulfilled. And we're not there yet. And to be quite honest, just the same as publics leaving, veterinarians are leaving, lecturers, academics are also heading overseas. So we have to be innovative and, just drive our, maybe something good will come out of this, that we can be proud of how we're fighting COVID-19 and retain people in our country so that we can improve the education. And yes, we do. I always encourage work shadowing. We do talks at schools. We invite, if students want to see, or learners want to see veterinary work, many veterinarians invite them in during their holidays to do their work shadowing. So we do our best to enlighten people about the profession so that if they do want to study it, but it is also because there are so few places, it's very difficult to get in. The academic requirements are rather high. So there are those challenges, yes.
Okay. Now, we have finished our time. I just want to thank you, Leon. You have enlightened, most of us about the profession and all the challenges and the solutions that you guys have put in place, how you are guiding the profession, as an association, how you're working closely with government, especially during the lockdown, and the council itself, So it seems like, things are actually working. I hope this session will go a long way towards creating awareness. A video of this interview will be available within the next 5-10 minutes, which can then be downloaded from the Dr. Fundi platform, and you guys can share it amongst yourselves as the profession. And also they can then give that to the patients, well, to the owners of the patients, because the patient is the animal. To the owners of the animals, because there's quite a lot of stuff that we spoke about. So I want to thank you for your time, coming at short notice. It has been an interesting interview for me, and I'm sure it's not the last time we ask you guys to come and address something that has to do with animals. So I want to thank you. I want to thank your PR team that facilitated this whole thing, and continue doing the good work.
That's a pleasure, Fundile. Thank you for the invitation. We are really grateful that we could provide the awareness, and let's not wait for a state of emergency before, we're there all the time for the greater good of the animals and the people, and the food security of this country. So, our doors open, and if you have any other queries, we'll be happy to engage with you again. Thank you.
Thank you very much. And thank you to all the viewers who joined us via the various platforms. We'll keep on trying to come up with interesting angles around COVID. Like today, this was a totally different angle, but very important one, because animals, you stay with them in your homes. And so we can't just be talking about humans. We also need to consider what the issues are that are affecting the animals as we are on lockdown. So thank you very much. Thank you, Leon.
Okay,
goodbye, everyone.
Well, obviously,
All
I
right.
just wanted the maths. Obviously, if there are 50 million people in the country and there are 3,000 registered vets, you can do the basic math there, and
Yeah.
it's a lot less than many. I mean, many countries have many veterinary faculties and graduates. So we've got work to do, but we want to do it because you know, all the animals have a right to veterinary care, and it's something we're working on with government, with the council, and we have a strong mentorship program that we're trying to help with the students and the veterinarians as well.
No, thank you for that. You must continue to lobby, because sometimes things happen if you are constantly lobbying, you know, those budgets, they must allocate some, you know, to get some of the students in because of the economic challenges that you mentioned. So continue lobbying as the association, and maybe something will come out of there. But also private companies can also, as part of their social responsibility programs, they can also fund some of the students, you know, so that we can find a way of increasing the numbers.
Well, that's as part of that SAVA CVC, we're also looking at an education situation that we wanting to build in an education to educate previously disadvantaged people within that veterinary clinic situation.
Yeah.
Okay.
All right then.
Thank you.
That's it. That's it for today.
Is phoning me. All right.
Okay. Thank you. Thank you.
Thank you.
Bye.
Okay, bye.